together we are the most famous physical therapists on the internet,
In our opinion.
in our opinion.
Well, that's important though, Bob. I think we should feel good about ourselves.
That's right.
And about our information, so.
Brad, what are we talking about today?
Yeah.
We're actually going to talk about pain in the butt, and that's not the anatomical phrasing
The
we're trying to
buttocks,
use.
yes.
The buttocks.
Yeah, but here we go.
But this is for the person who's feeling.
Butt, did you get that?
Yeah, I got that. That's funny.
No pun.
This is for the person who's feeling some pain in their butt and maybe some referral of the pain down the leg. Okay?
Right.
Now, along with this, you are not. I want to make sure you're not having back pain with it, because if you're having back pain with it, there's a good chance it might be coming from your back. So this is what we're going to talk about specifically is actually called piriformis syndrome, and so we're going to talk about the piriformis muscle. And we lost our camera woman. That's all right. We'll keep talking here. The piriformis muscle actually crosses over the sciatic nerve.
It's from here over to here, and that's the area we're looking at, and that's
Well, we're gonna show-
butt pain, but it's really that muscle that's located there.
Yeah, we're showing the spine here.
Yeah,
All right. Actually, we have two students here today, Brad.
great,
Yeah. Why don't they come out, because they're going to tell us. I want to see if they know their anatomy at all.
exactly.
If they don't, that's all right. We'll help you out.
Brittany,
But
why don't you come up here first? What school do you go to, Brittany?
UW Lacrosse.
Get Sam out here too. Let's get them both.
Well, one at a time, I didn't.
No, they both can fit out here.
Okay,
Come on.
all right.
Say hi.
Hi.
Okay, where's the piriformis? It actually starts. I'll give you a clue. It starts. Any clue? Any comments here? It starts on the sacrum. I think up on like what would be S2, S3, S1, S2, S3, and it actually inserts on the greater trochanter. Okay, so what it does, I'll send this on. Thanks, girls, for your little cameo there. Can you focus up on here now?
What, did you say where it ended up?
Yeah, on the greater trochanter.
Oh,
On
yeah,
the hip.
the hip, yep, right there, thank you.
So, can you see that, Nancy?
Yep.
All right. And as you can see, it crosses over the sciatic nerve. What is interesting is also sometimes the sciatic nerve actually splits through the muscle, or sometimes the sciatic nerve goes splits around the muscle. It actually does a lot of different variations anatomically. But the problem is if this muscle spasms or tightens, can you see how it'll put pressure on that nerve and it'll send the pain down the leg? So on Brad, I don't know that I really want to touch your butt, Brad, but watch your face here.
My wife will get a little excited.
Yeah. Oh my God. Anyway, right here is the sacrum and it attaches over here. So we're talking about pain right about in this region here. So,
This reminds me, a lot of people say I got sciatica. Well, this
Right.
is the sciatic nerve that it actually is impinging, so another common name, they got sciatica, piriformis syndrome, similar.
right. Actually, and what we're going to do today is we're going to show you one stretch that you can try. And even if your back was involved, I mean, and you weren't feeling any pain there, this is a safe stretch to
Right.
try.
Right.
If you have piriformis syndrome, you can try this. You can try a few of the things that we said. If it doesn't get better, then you have to see your doctor, see your physical therapist. I mean, we're not trying to diagnose this because it is quite often a difficult diagnosis to
Right,
make.
right.
I've had about 4 of these patients this year, and they aren't that common. I mean,
Right.
more often I would say it's back pain that's causing this than
And referring down the leg,
Referring
referring
down
the
the
low
leg,
back,
so-
right, exactly.
All right. So one sign, another sign that might be evident is that this muscle actually turns your leg out. So if you walk with your leg turned out and the pain feels better, that's a possibility again that it was the piriformis muscle. The other thing is, Brad, why don't you go ahead and lay down now? Okay. This is the stretch we're going to be doing. It's called the fair stretch, flexion, adduction, and internal rotation. You don't need to know that. All you need to know is, let's say this is the side the butt hurts on the left side, Brad's left.
Right.
All right, what he's going to do is he's going to flex the knee and he's going to pull it to the other shoulder, to the opposite shoulder. Yep. That's really all you really need to know. I don't want to make it any more complicated than that. And a good, what, 1 to 2 minute stretch, Brad?
Yeah, and I'll even start out with less, and like you had said before, I'll say, can you stretch this side, and then compare it to the other side, and see if you notice a difference. And if the one side where you're having the symptoms is much tighter, and I have patients say that too, it's
Yeah.
like, oh yeah, that's definitely tighter. it's another indication we're going after the right muscle.
That's exactly right. That's a good possibility then that is the problem muscle. So you want to go ahead and do that stretch, work up to a couple minutes. The other thing is, because of the location of this muscle and the location of the sciatic nerve, if you're a guy, or I guess even a girl, if you wear, put a wallet in your back pocket, you're going to want to stop doing that.
Right.
Especially sitting on it. I mean, it's
For a
just
long
going
period, like
to,
you have to
for a
drive
long
for a
period.
couple hours.
I actually, when I was younger, I stopped doing this because I remember my leg turning numb one time when I was driving, and I actually had trouble putting the brake on because my leg had turned numb. So yeah, it was kind of dangerous. But anyway, so you want to stop that. The other thing you could try is getting some massage from a masseuse or whatever, or a partner that could try to massage that area, because that often helps. Ice, heat, all those things are also very acceptable.
Sure. Right.
But again, we're not trying to diagnose this for you, so you're going to want to go to a doctor or a physical therapist if this problem persists.
Exactly, just a simple stretch with that fair test, that we call it, or knee to the opposite shoulder while you're laying on your back. Do it gently, don't get too aggressive with it. And anything else, Bob?
That should do it.
Okay, thank you.